In Nevada, cases have increased 72% in the past 14 days, with an average of more than 5,000 cases per day. Hospitalizations in the state have increased 48%. Let's talk more about this. Let's bring in medical director at St. Mary's and Carbon Health Network in Nevada, Dr. Bayo Curry-Winchell. Doctor, hospitalizations now doubling statewide, and Nevada may not have even hit its peak, we are told. Explain what it's like there for you and how hospitals are dealing with this surge.
Well, thank you for having me. We on the West Coast have not peaked, and it's important to really let the entire country know that on the West Coast, we are still experiencing a high level number of hospitalizations as well as record number of cases. So our hospital systems are strained and we are in a crisis, especially when you look at how short staffed here in Nevada we were pre-pandemic. And then you have this additional surge that really puts a lot of, stress on a system that was already challenged.
So as a doctor, how are you dealing with this every single day? How's it impacting your job, the shortage of healthcare workers and hospital beds? Describe to us.
So, as a doctor, I do the best that I can, and I really lean on my colleagues. I am so proud of the healthcare workers that I get to work with here in Nevada. Personally, it is challenging. Every day you go in and you are seeing a blend of patients, those that are unvaccinated and are regretful that they didn't, receive the vaccine, as well as you're also seeing breakthrough infections. So you are doing your best to, whether it's, work extra shifts, overtime, but just doing our best to provide the best care possible while taking note of self-care. And I think that's important for all of us, especially during these times.
Tell us your wish list. If you had the president's ear, what do you feel as a doctor you need right now?
We need to have more access to testing, an investment in health literacy, and really lean into representation, because not everybody receives health information the same way. And we really need to really think about different cultures, ethnicities, races, and how we can speak to them and deliver healthcare, because that's how we're going to really help not in the pandemic, but really be able to help so many patients across the world. So please get vaccinated, educate yourself, and find credible information.
How do you think what you're dealing with right now compares to early on in the pandemic?
This time is harder, especially when you think of the fact that we have vaccinations readily available. And so we are dealing with a level of mistrust and misinformation that really makes it harder for us this time versus at the beginning of the pandemic. So that part has been very challenging.
Well, we will continue to follow what's happening in your state and across the West Coast, of course. Dr. Bayo Curry-Winchell, thanks so much for your time this morning.
Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.